Good morning. First of all, I'd just like to say it's really my tremendous pleasure to be here today for the last 4 days in the same clothes and to share the experiences I've had as an advocate with the Leukemia and Lymphoma Society. From now on, I will refer to the Leukemia and Lymphoma Society simply as LLS. So if you hear that reference, you'll know what that is. This morning, as I was preparing, I looked at the topic for my presentation and realized that it said managing distress as an advocate. And I thought I should add to that, managing distress as an advocate in the same clothes for 4 days without luggage, and recognizing that I had computer challenges as well. So I thought really appropriate that I'm doing this presentation. So I asked for your tolerance in not only my wardrobe, but special thanks to the planners here who helped me obtain at least an extra shirt. And also just the fact that I need to refer to my notes because of my computer challenges. So with that said, okay. Help me here. And now I have computer challenges as well. Thank you. Perfect. Okay, thanks very much. So anyway, the point of my presentation today is to really talk about strategies that advocates can use in managing stress in their everyday lives, enhancing communication, and ultimately improving the quality of relationships amongst their colleagues and with patients. So I thought I would start off with my experience as an advocate. And in January 2003, I should say, I've been with the Leukemia and Lymphoma Society now for 13 years. And for the first 12 and a half of those, I was at a chapter level in California. So I worked directly with patients and families and healthcare providers. Since just last summer, I now have a national position as an information specialist. So in 2003, Joni and Mary were diagnosed with CML. It just so happened that their mothers both resided in the same retirement facility, and the conversation went something like this. My daughter's been diagnosed with something called CML. And the other mother responded, really? My daughter has CML too. So the two daughters met, Mary and Joni, and I can tell you that the rest is history. The CML Busters were born shortly thereafter. It's a takeoff on the Ghost Busters. So they really looked at the fact that they were going to bust right through CML. But keep in mind, this was early 2003. They came to the chapter and they said, we need a CML-specific support group. Our needs are just not the same as those who are going through standard chemotherapy. We're looking at a different side effect profile. We have an opportunity for long-term survivorship, and we really need to have our own meeting. Will you host us? As I said, the CML Busters were born. They developed their own logo that you see here, and seed money was initially provided by Novartis for refreshments. They actually had T-shirts, hats. They had a whole ensemble going. Some of the early issues they discuss, and this group is actually formally a support group of the Leukemia and Lymphoma Society. So there were some guidelines that they had to meet. They had to have a formal facilitator, and I was their facilitator. Although I have to say they were a very strong and robust group, so they really ran themselves. And I just was there to learn and to make sure that the room was set up. That was sort of my role early on. So we discussed some of the issues of dealing with the diagnosis, certainly TKI compliance early on, side effects. Many of these people had been on clinical trial with STI 571, as it was known, probably some of them with Dr. Shaw in those early years. And so almost everybody was on imatinib. We talked about the financial impact of treatment and costs and resources at that time, keeping in mind that we're in the US, and so there was, if you weren't on clinical trial, the cost for this drug was really quite high. It was important for us to share information with other hematologists, oncologists in the area, so the team, I should say, all of the membership actually took on the role of identifying CML experts in the area, and I would tell you that there were two very prominent hematologist oncologists that supported the group then and continue to provide expertise in the form of education programs today. some of the current issues they're talking about. The group has, you can imagine, since that time, it's over 10 years, grown substantially. There's still a core group of people that attend every meetings, and for those of you who have ever visited California, you know what the freeway is like. And so just getting to meetings in California can be quite a challenge, but they come from pretty far and wide. At this point, we have patients who've had stem cell transplant. They're on all of the TKIs. We have people on bosutinib. The one thing we don't have is anyone who has taken part in a STOP study. So those are some of the current issues that they love to discuss now. Certainly generics and insurance issues, because the U.S. is now part of the taken on the Affordable Care Act. So those are some of the issues we discussed. But most important always is support of the newbies. They consider that their most important function. And I have seen them really take someone and say, bring me your lab results, and they just tear them apart at a meeting. So it's really a very wonderful group. It's been such a pleasure to work with them. They're not just a support group, they're a social group. Some of the important issues they discussed early on were whether it was okay to drink wine when you were on a TKI, and as I saw last night and at every meeting that we've had here in the evening, that it's certainly okay to drink wine when you're on your TKIs. They're not just a social group or a support group, but they're also a major fundraising group, and they have raised money, almost $250,000 since their inception, and this has gone directly to cancer research. So they're a pretty amazing group. So I wanted to start off with a definition of CML, or what an advocate is. I think we've seen that our advocates here take on many different roles. We have lots of different talents, but for us, it's an individual who takes an active role as an informed, communicative decision maker about the many aspects of cancer diagnosis, treatment, and survivorship. They can be cancer patients, they can be family members, caregivers, healthcare professionals, anyone who takes part both at a personal, global, national level. So we see that there's many roles in terms of many definitions for this. So I think regardless of what definition we use, which definition you feel best describes you, the point is that I think we can all agree on that this is really important work, and work that comes with a certain amount of stress. And I like to think that most of us survive on, or thrive, I like to say we thrive on a certain amount of stress. It gets us excited, we start to accomplish things. So it's, some stress is really good in that we thrive on it. But it's when it becomes unmanageable and really becomes too much and we move into survive mode that we really need to come up with some strategies to manage it so we can continue to be as effective as we need to be as advocates. So I thought we'd start off with a definition of burnout, so allow me to read this to you. It's just another working definition: the emotional, physical, and mental exhaustion due to overwhelming and prolonged periods of stress. And I think the key words here certainly are overwhelming and prolonged. And so anything that, I think it's natural or normal, I should say, for advocates to put our own needs aside to focus on the needs of those that we're advocating for. So this makes for a great advocate, I think we'll agree with that, but it also, and great partnerships with other people, but it's not necessarily a recipe for self-care. So in the midst of chaos, for an advocate, you have two options. You can either manage yourself, or you can enhance the kinds of the relationships that are working with you in terms of patients. So we're going to start off by doing a discussion of, the importance of doing an honest self-assessment and planning some self-care strategies, and then we're going to shift gears completely and identify tools that can enhance our ability to work well with patients, and then the importance of staying connected. So this is sort of a graphic presentation of what self-care could look like and what might be involved in a self-assessment. I personally think it could be answered very simply in some straightforward questions. Am I happy and fulfilled? Do I have a shorter fuse than usual? Are friends, family, and colleagues perceiving a change in me and letting me know about it? Do I laugh easily? Am I overly obsessed with work-related issues? Am I losing sleep? So I think we can begin to answer these questions fairly simply. So there are certainly some personal strategies of self-care. And probably none of these are too surprising to any of you, but they include things like eating well, exercising, taking vacations, getting enough to eat, getting medical care when you need it. So those certainly are in the realm of possibility. The emotional ones, giving yourself a break, laughing, crying, arguing, appreciating the work that you do, some of the emotional strategies. Psychological strategies like self-reflection, reading, taking part in other kinds of support groups. And then spiritual, spending time outdoors, identifying what's important to you, praying, meditating, however you find inner peace. So the important thing about these personal strategies is to put them together with these workplace and professional strategies. How many of you would identify that just finding the time for these personal strategies is challenge enough? I think that's always true of us. So some of the workplace strategies would be, having a work environment that works for you. I have the privilege, I should say, of working from my home environment, so actually I dress like this every day anyway. But the importance of having, a situation where you can create a break, where you can chat with your colleagues, those kinds of workplace situations. Professional strategies if needed, seeking professional help if that's important and necessary, and that ultimately the goal is to achieve balance in work, family life, our volunteerism, play, and in our relationships. So I also wanted to discuss just a little bit about, beyond the personal and workplace and professional strategies, some strategies that can increase your ability to believe that you can actually succeed, so self-efficacy. So I think it's really important in terms of building your self-confidence as an advocate, and that really the best way to do that is to get the appropriate experience. That can certainly increase your confidence and make you feel like you're able to accomplish the goals you need to, and to exercise control over the things that need to get done. Identifying a mentor or a role model, always an important thing, and I think you can find somebody who has been successful in accomplishing the goals that you hope to accomplish, and that you can observe and learn, and I always say borrow best ideas. So that's certainly, and there's certainly no shortage of mentors in this room, so I think that's been really one of the most noticeable things for me. Identifying your needs as an advocate and making sure that you have creative outlets, that your work is not the only thing that you focus on, that you take time to take care of yourself, whether that's through time management strategies or personal strategies, because and when I say it, whether that's work, chores, homework, family, it will always be there even after you take a much needed break. And more importantly, getting support where you can find it. Clearly, it takes time and effort to maintain those kinds of social relationships, but those are the most important things in inoculating you against burnout. And then finally, strategies to empower the patient. And I picked this quote on the left because I think it's really pretty remarkable. It's pretty standard, but I've included a couple of things. So today it is not possible to deliver good quality cancer care without using existing approaches, tools, and resources to address patients, caregivers, advocates, and family psychosocial health needs. So I think it's really important to include that in there. So I just wanted to talk a little bit about some of the programs that we use at the Leukemia and Lymphoma Society, a best practice model, the Patty Robinson Kaufman First Connection program is an example, and then I would have provided updated and relevant information if my luggage had arrived, but since it hasn't, you're going to have to contact me via my website, or via our website. So this is sort of a complex diagram that talks about action steps and decision making that we use at the Information Resource Center. I'm part of that staff, that we use in our interactions with patients. And it's to facilitate, we just call it the best practice model. We really don't call it the resources best practice toward facilitation. But it's just interacting with patients and making sure it's a comprehensive interaction. And most of our interactions are via the phone. Some are online and via email, but the majority are over the phone. Most importantly, just a couple of boxes here, because I'm watching my time, is that we want to meet patients where they are. And that's the most important thing. I think we can all agree that being listened to in that initial call or in that initial conversation, if it's in person, is the most important thing. We just need to make sure that we're being heard. So personally, that's a really important box for me. The third one, building confidence. I think it's our responsibility as advocates to encourage positive action steps and encourage our patients to take roles that will benefit them and benefit their families. So building their confidence and that they can actually do this. The other one that I think is really important under direct the caller is offering manageable amounts of information. I think there's a tendency that if one piece of information is or two is good, then 10 is even better. And one of the things that we've really learned is that small amounts of information in manageable bites is much more, is going to be a much better idea for both patients, and they're not going to be so overwhelmed that they do nothing. So manageable amounts of information. And finally, we have used this as a follow-up mechanism. So this is a best practice model that was developed in collaboration with the Columbia University, and it's something that we use in the ongoing evaluation of our programs and services at the Leukemia and Lymphoma Society. Although it's our best practice model, it was never intended to be something that was isolated just for us, and is really intended as a jumping off point for anybody, regardless of training, to use as a tool when they're interacting with patients. So this was actually provided to volunteers who might be working at a health fair or at a community level in interacting with patients. So just quickly about our First Connection program, for those of you who may or may not know about it. It's our version of a buddy program. So we connect patients that may be newly diagnosed with individuals who are on the other side of treatment, or in the case of CML, stable with their disease. So this is a national program for us, and it's both national and in Canada. And we can, we have the capability now of matching people on a variety of factors. So we can match them on their TKI, on their age, on their gender, even on their location in the country. So this is a very important person. And it's that power, it's the power of survivorship. And it's, it's a shared experience and a very positive program. This program has actually been implemented very similar using our guidelines in Australia. There would be the updated and relevant information that I had hoped to bring to you. And since it's not with us, you can see that on the right, the booklets and fact sheets, those are all of our CML-related materials. They've been referenced here a little bit. We have some very comprehensive materials, and actually they've been reviewed by Dr. Shaw. And we have a comprehensive booklet as well as a CML guide. So just finally, I just wanted to say a little bit about the power of staying connected. And that as advocates, we work in a variety of settings. We have a variety of skills and talents. And I think it's really important to, in order to grow in our roles, that we share this experience. And I think there's nothing truer than the mission statement over here where it says, learn, share, and grow for the CML Horizons. And this is so very, very true. In summary, I highlighted persistence because if I'm nothing else, I'm persistent. One of my colleagues says she doesn't take no for an answer. She thinks no is just temporarily means not yet. So I like to use this as well. So if somebody says no to me, I really take it as not yet and move on. Always sharing resources and best practices, recognizing and appreciating the nature of groups both large and small. That's been a wonderful opportunity for me. And realizing that the majority of the work is frequently done by a small group of people, but trying always to be inclusive, staying connected with your colleagues, your fellow advocates, and finally keeping that all-important sense of humor that really gets us through so many situations. So I started off discussing the CML support, the CML Busters, and there you see some of them at a recent event. I want to just say one thing about this group. There are certainly tears at this group. There are the new individuals, there may be tears and they may feel very overwhelmed, but laughter and humor outweigh everything with this group. And I think Joni, who's in the front row here, says it best, that the CML Busters are the best group of people you've never wanted to meet. So with that, I'd like to say thank you, and if there's any questions, and I'm sorry I went over. There's my references, and if you have any questions, there's my email.